Hi there, Richard Lobenberg here from Yellow Gazebo Natural Healthcare in Toronto. I'm a registered traditional Chinese medical practitioner and acupuncturist, and I'm here today to tell you how to rub your tummy. Seriously though, I am here to tell you how to do proper abdominal massage for digestive health. There are specific abdominal digestive or abdominal massage techniques that you can have done to you, registered massage therapist, or even our naturopathic doctor who runs the Belly Be Well program can do different types of massage. I'm here to show you just some very basic tips based on what we do in Chinese medicine that can help you just be relieved a little bit of some acute pain. So what you want to know is where your midline is, easy enough, and you want to know roughly where your stomach meridian is. The stomach meridian runs from your head down through the nipple line, cuts in a bit, then runs on either side of your belly button, on either side of your midline. So it crosses through the liver, which is just under your ribs there, and it crosses through your rectum, which is down here, and part of the large intestine up here as well. And on the left side would be, it crosses through your spleen a bit, and your liver comes right across, so it probably crosses your liver over here as well. But some key points in massage. So often when we're little kids, we learn to rub our tummies, and it feels good, and it does, especially after a while. You know, you're hitting a lot of those points on those meridians, and sure enough, that's going to help a bit. But if you're feeling really bloated or uncomfortable, that kind of massage is not going to be enough. So a couple quick things. The point that runs just under your ribs here, on your stomach meridian, essentially what you're going to be massaging is abdominal muscle, okay? And the first thing that you should know is that you're not going to hurt yourself. You're not strong enough, especially in a sitting position, to be able to hurt yourself at all. Don't massage bone. Don't ever press on bone. Just make sure you're pressing on meat, okay? Muscle, essentially. So what you want to do is, if you have abdominal issues, chances are this point might be a little tender. So reach under your ribs with your fingertips and just find where it's a bit tender. It may feel really weird at first. You may have to dig a little bit under your ribs, but you want to find it and really just hold it there. Just work it out a little bit. You might want to work on that spot for just a minute or so. You don't want to overdo it, but you can't really overdo it either because you only have so much strength in your fingers. You can do this lying down, although to get in this spot, it's a little easier to get to when you're sitting up. Okay, so the other spot that you want to look at is actually where I said the stomach meridian crosses the rectum. So you might want to sit back a bit for this. And again, you're going to kind of think it's kind of roughly where it's tender, essentially. And there, I found it, and I want to just work at it a little bit. Again, you're really massaging muscle tissue. And why is that tender when you have digestive issues? Well, probably what happens is the organs inside get a bit inflamed. The organs probably being, your liver can get a little bit tight when your digestive system is not working very well. Your large intestine can get a bit inflamed. And that aggravates the muscle tissue a little bit. So by massaging the muscle tissue, you can maybe help relax these other organs and just help everything flow a little bit better. Now, why don't you right now just think of your abdomen as kind of a rectangle? You want to think then of hitting kind of sides of that rectangle. Everything in between is probably okay to work at, but if you work on that rectangle, you're going to hit all or most of the really tender points. So if I'm working, and once you've done this a little bit, you can find the edges of that rectangle and just kind of work where it's tender. You might want to not do this in public because it'll look a little weird. Maybe do it at home. There, I found a good point there. Work at that a little bit. feels a little strange, feels a little, almost a little sharp, but not painful, just sharp for a second, just a bit achy sharp. Now, in Chinese medicine, sharpness is blood stagnation, achiness is qi stagnation. If you have any questions about this, please email me at info@yellowgazeboclinic.com or call me at 416-909-2334. You can make an appointment with me and I'd be more than happy to show you some of these techniques. If you have any other questions about any of our other services, please feel free to call as well. Thanks and have a great day.